I want to thank everybody for attending today, the Hope and Healing Foundation. Cedric, my name is Nicole Albanese Bell. This is Cedric Bell.
And we are the Hope and Healing Foundation, folks, for suicide prevention and mental health wellness. And our mission is to decrease suicidal deaths among youths and veterans in Florida, along with the United States. But we're starting in Florida, folks. And I'm going to pass it back to Nicole.
We do have a fundraiser going on right now. It is for my late cousin Jessie, who for her children actually. We recently lost her to addiction, so this presentation is actually dedicated to her. And we thank Jill so much for taking the time out to educate us a little bit further on addiction. And the topic of our presentation today is hijacked by drugs and alcohol. And Cedric is going to introduce our presenter.
All right, folks, tonight for the Hope and Healing Foundation special guest speaker, we have a good friend of ours and colleague, Jill Stellaccio. How you doing, Jill?
Good. Thank you so much.
Welcome. Jill has been an active member in the mental health and addiction field for over a decade now. Jill is also a mental health clinician, board certified addictions counselor, and a proud alumni of Nova Southeastern University, where she obtains her master's in forensic psychology and was also inducted into the International Honor Society in Psychology. Jill specializes in cognitive behavioral therapy, rational emotive therapy, and she has a person-centered approach to treating her clients. Jill has conducted several speaking engagements, and her most notable is when she was invited to be a guest speaker for the SoberSmash Radio station, which is an international online platform that talks about substance abuse, recovery, and mental health awareness. Currently, Jill is a mental health practitioner and sees her clients for mental health and substance abuse counseling in the state of Florida via telehealth. And she is one of our present therapists at Advanced Client Care Mental Health Agency located in South Florida. We thank you, Jill, for your time. And we know we have a good presentation coming forth us. So we thank you for coming.
Thank you so much for having me.
All right. I'm going to share the screen for everybody, Jill, for your program here.
Thank you.
And you can feel free to start.
Okay. Well, nice meeting all of you, first and foremost. And I want to take a moment and thank Cedric and Nicole so much for giving me this opportunity to talk about the brain and addiction. It all kind of worked out perfectly. This is a topic that I always share when I am visiting agencies and I'm doing groups with clients or with colleagues. And it's surprisingly a topic that is not discussed that often in treatment centers, as I believe it should be. Whenever I go over this information with clients and with colleagues, mostly colleagues know, but clients and their families often don't understand the brain science behind the disease of addiction. And this is the evidence proving that it is a medical condition, and it's so important for everyone to know. So when Cedric and Nicole asked me to do this, this is the first topic that I thought about, and it's always the topic that I go to. So I hope that you all get something out of this. The first thing that I wanted to touch on prior to even getting into the actual presentation is for those of you that are familiar with the addiction field, there's this debate that has gone on for longer than you could imagine, since the beginning of 12-step and just addiction science in general, regarding whether it is a disease or not. And the information that I'm going to be sharing with you is not information that, I have, necessarily come up with. This is information that's coming straight from the National Institute of Drug Abuse, which is directed by Dr. Nora Volkow, who is the pioneer of brain science and addiction. And she has been able to really hone in on exactly what's going on with those individuals that suffer with addiction and why we can call this a disease in the medical field. Okay. So before getting into this, I wanted to just mention, when we're talking about the medical field and we're talking about labeling something as a disease, there are three very important criteria that the medical field typically focuses on. Okay. I'm sure there's a lot of other criteria, and I'm not trying to speak on things that I don't have experience with, but I know that there's three important criteria that qualify something as a disease. And the first is, it has to be detrimental to the person. And the second is, there has to be signs and symptoms that something is wrong. And the third is, there has to be some kind of abnormal test to prove that something is wrong. Okay. And when it comes to addiction, we know that it's a detriment to the individual who's suffering, because we've all been touched by addiction in some way, shape, or form. We know that there's signs and symptoms because when you're interacting with an individual that is under the influence or is struggling with addiction, you can see clearly that they are suffering from all kinds of different symptoms: lethargy, depression, physical symptoms, et cetera, et cetera. And there's also the change in their identity. You know, if you know a loved one prior to addiction, they're very different as people than they are during their addiction. Yes. So this is all very indicative of something serious going on. And addiction meets all three of these criteria. Okay. And the abnormal test for addiction would be a brain scan. Okay, so this is what Dr. Nora Volkow started to research and discover. And the reason why she did is because her father was an active alcoholic, and she would notice his personality change, and he would become very abusive. And then one minute, you know, he would be very loving and nurturing. And so she made it her mission to discover what happened. And he unfortunately lost his battle with alcoholism, and he passed away. So she made this her life mission ever since. And thank God, because she's the reason why we can bill insurance for addiction, and we can call this a disease finally, and actually help people, right? So the abnormal test of addiction is the brain scan. And what she did was, she was able to look at various individuals that struggle with addiction. She was able to, it's called a PET scan. You kind of look from the top, and she noticed that there are three different regions that are being affected when it comes to drug abuse and alcohol abuse. Okay. And that's what we're going to go over here today, because it's so important for you guys to understand, if you have a loved one that struggles with addiction, to understand the chemistry that's going on underneath, so that maybe you can have a better understanding of why they behave and do what they do. Okay. Okay. So we can go on to the next slide. Okay. So obviously, I mean, we know this. The brain is us, right? It's the most complex organ in the body. It regulates your basic body functions, and it allows you to interpret and experience your life. So everything you think, everything you feel, everything you do is a direct result of your brain function. If there's an imbalance in that brain function, you typically behave a little odd. So we can see that something's going on, obviously, if there's something off about that brain function. Okay, next. Okay, so essentially, when we're just talking about addiction impacts the brain, we're going to focus in on three very important parts of the brain. Okay. So obviously, we know the human brain is like a computer. There are circuits, there are networks, and the ones that are most impacted by drug addiction include neurotransmitters, receptors, and synapses. Okay. Now, some of these neurotransmitters that are impacted by drug addiction, there's a lot of neurotransmitters, but just for the sake of time, we're just going to go through these 4 because these tend to be most impacted by various drugs and alcohol. So we have serotonin, which is something that helps with our mood regulation, very important. It deals with learning, and it deals with reward. And it also deals with an overall sense of, if it's balanced, it gives you an overall sense of well-being, just as a human being in the world, right? When everything's functioning properly. Serotonin is very important when it comes to living in a functional way. Dopamine would be the other really important neurotransmitter that's impacted by drug and alcohol addiction. This deals with reward and motivation. GABA is another one, which is essentially known as a blocker or an inhibitor. It reduces anxiety if it gets too low. It kind of calms things down a little bit and balances things out. And then there's epinephrine and norepinephrine, which are considered the brain and body mobilizers and stabilizers, and they also deal a lot with adrenaline and fight or flight response. The best way that I like to, the best example that I like to use when I'm speaking with clients when it comes to how the neurotransmitters are transmitted in the brain is, you're all hearing my voice right now, right? So my voice would be the neurotransmitter, and your ears are the receptor taking in my information, right? And then the space between us, the speaker, the headphones, and me, and my computer, the space in between is the synapse, okay? So this is essential for that communication to take place. And when there's a disruption, if my computer was to shut down or something, you wouldn't be able to get the information that you needed, right? So the same thing happens with addiction. When drugs and the chemicals of the drugs are being introduced, it disrupts this flow of communication and the flow of neurotransmitters. Okay, all right, next. Okay, so Dr. Volkow discovered 3 very important, I want to say the entire brain is negatively impacted by addiction and alcohol, no doubt, especially alcohol. Alcohol is actually the worst, if you guys don't know. Out of all of the drugs of abuse, and alcohol is a drug, and a lot of people, for whatever reason, separate that, and I don't know why. It is a drug, it's the drug, and it does more damage to your body and to your organs and to your brain than anything else. And alcohol and benzodiazepines, such as Xanax, Valium, Ativan, Klonopin, things like this, they're the only 2 drugs of abuse, benzos and alcohol, that you can die from if you don't detox properly. So you can have a fatal detox if you don't come off of it properly. That does not happen with opioid detox, opiate detox. That does not happen with meth, cocaine, any of the others, because benzodiazepine and alcohol affect your brain system so much you could have seizures and horrifying symptoms, and you could just not make it through. So that's why we treat those as crisis detoxes, okay? Very, very important. So that's important for you all to know, because if you ever deal with an alcoholic, they're telling you, I don't do heroin, I don't shoot up, it's not that deep. You can tell them what I'm telling you, and you can Google this and get all the proof of it as well, okay? All right, so the entire brain is affected, but there are 3 very important parts that are affected the most and that affect our functioning the most. And these are really important parts of the brain. So we have the prefrontal cortex, which is responsible for rational thinking, decision-making, judgment, and impulse control. Pretty important part of the brain. So I like to compare this to almost like this is your street light in your head. So there's a red light, there's a yellow light, and there's a green light. And in a healthy prefrontal cortex, the yellow light is blinking and working very well, and it will help you pause prior to making any decision to either stop or go, right? In an addict, there's no yellow light. It's dim, it's not working, it's another color. I don't know. There's some kind of something going on. And that's because of the drugs that are being used. So it dims out and there's only a stop and a go. Okay. So that's the prefrontal cortex that's being impacted. The next area of the brain that is very impacted is the extended amygdala, which deals with stress response. Fight or flight is in there too. Motivation. This is the primitive area of the brain, like the animal part of the brain, right? It doesn't care about right or wrong. It doesn't care about what's moral. It doesn't care about whether your kids care about you drinking or anything like that. All it cares about is motivating you to repeat certain behaviors, okay? And dealing with that stress response in order to survive as well. There's a lot more to it too, I'm sure, but this is just what I know as far as the addiction part and how it affects that part, okay? And then the third area is the basal ganglia, which works alongside the amygdala. They pretty much do the same thing, but the basal ganglia works on positive forms of motivation and pleasure and reward. So the basal ganglia is what is stimulated when we engage in healthy activities, such as exercise, socializing, good things. And you get pleasure and reward from that. And these are also healthy activities that are key to our survival, right? Like sex for procreation and eating and drinking water and things like this. So it's a very important part of the brain. And typically the basal ganglia and amygdala and prefrontal cortex, if you have a healthy brain that is not addicted, they communicate quite well and they balance each other out. But when addiction comes in, that's when things get a little crazy. Okay, next. Okay, so we're going to go a little bit deeper into these parts of the brain so that you understand just a little bit more about what the impact of addiction is and also how Mother Nature kind of messes with us here. So we talked about how the prefrontal cortex is responsible for our ability to think rationally, to plan things, to solve problems. And it's also responsible for impulse control. It's okay. For impulse control and decision making. Now, Mother Nature messes with people this way because the prefrontal cortex, unfortunately for people that are suffering with addiction, doesn't fully mature and develop until the age 25. It's the last part of your brain to fully develop. Everything else comes first. Amygdala is something, and I have a medical colleague that's on here. She may be able to clarify this for me after, but I think the amygdala and basal ganglia is something that develops quite early on in life, like within the first couple of years of life. But the prefrontal cortex is the last one. And it's funny because it's the most important one. So this is what domesticates us, right? And so when we're dealing with clients or, just individuals that are struggling with addiction, most are using drugs prior to this age. And so what that creates is almost like an underdeveloped prefrontal cortex, right? It almost stunts it a bit. Okay. So in the rooms of the 12 steps and also in treatment, we always talk about clients being the age of when they first started abusing a chemical. In other words, I have a client that started using meth at 16 years old, right? When she came into treatment, she was 23, right? She still had the mentality of a 16-year-old adolescent at 23 years old, right? Because of what the drug did and because there was underdeveloped parts of this brain. So it was just a lot of impulsivity and a lot of up and down and a lot of mood lability and very difficult to control. Yeah. So that's something that's really important that kind of blows clients' minds a lot of times. They don't always realize that. So good for you to know. And when drugs and alcohol are being used prior to this age, like we said, there's a significant disruption in the individual's ability to think rationally and make mature decisions. Okay, next. Thank you. All right. So the next part we have is the extended amygdala. And the amygdala plays a role in stressful feelings such as anxiety, aggression, and fear. So like we talked about, this is like the primitive area of the brain, the fight or flight, response. So, back in caveman days, there wasn't much of a prefrontal cortex going on. So it was like kill or be killed, fight or flight, do what you need to do to survive kind of thing. And there was a lot of aggression, right? Because we were more animalistic at that time. Nowadays, a lot of our anxiety and aggression and fear is suppressed. And sometimes the addiction can bring that out, or mental health issues can bring that out. We don't know how to cope with it properly. And so addiction can cause a lot of problems here. This area of the brain is a part of what we call the primitive brain. It's also a part of the limbic system, the pleasure reward center. And it's responsible for providing us with the drive to survive. The primary role also is processing of memory, decision-making, and emotional responses. When drugs and alcohol are being used, the amygdala becomes overactive, which leads to high anxiety, discomfort, and when the drugs and alcohol are not available to the substance abuser, that becomes worse. So emotional responses like fear and aggression heighten, causes changes to the individual's personality, causing them to become almost animalistic. And that fear response is so strong, they don't know how to deal with it. So then the cycle of addiction kind of gets reinforced. Okay. The amygdala is what's causing the discomfort, by the way. So it becomes very sensitive because of the drug use. And the fear and anxiety is just rising and heightening. And the drugs are the only thing that brings it down and calms it down again. Okay. Okay, next. All right. And then we have the basal ganglia. So like we said before, responsible for many functions, such as emotions and also motor skills. It's also responsible for implementing pleasurable effects on the brain. So it houses the reward circuit, like we spoke of, and this area provides positive motivation for the individual to continue certain behaviors such as eating, socializing, exercising, sex, things like this. Drugs and alcohol cause the reward circuit to overactivate, leading to a euphoric feeling from the substance, which the brain was never really supposed to experience. Okay, next. Okay, so this is where, if you haven't heard this term in treatment and in the recovery field, we talk about the hijacked brain. So this is where that happens. So when drugs of abuse, and this includes alcohol, are being used repeatedly and consistently, these three areas of the brain are essentially hijacked by the effects of that drug. So the drug abuser's brain is essentially tricked into thinking that it requires the drugs to survive and to function. So this occurs because the drugs create this euphoria that the brain was never supposed to experience, right? And these primitive areas of our brain are very focused on reward and very focused on pleasure. And when it experiences pleasure, it wants to continue that behavior. So essentially, our brains are working against us, if that makes sense. So the pleasure and reward system becomes overactive. And the prefrontal cortex of judgment and rationale becomes underactive. And so now what the brain is doing is it's only focused on that pleasure and reward, and it believes that it needs the chemical in order to function properly. And essentially, that is correct, because early on in addiction, that is what it does. It creates a situation where the individual thinks that they're functioning better, that they feel more confident, they feel like they can perform at their job better, they feel like finally they found the answer to their anxiety or stressors or what have you. It all feels good in the beginning, and then we have this hijacking that takes place that creates a situation where parts of the brain are no longer communicating, and the only thing that the brain wants is that pleasure. Okay, so eating isn't important anymore. If you've ever worked with a client that struggles with addiction, they usually have either a lot of weight for overeating, or they've lost a lot of weight because they're not eating. They're malnourished, they're exhausted, they're either, if we have a meth user, they're overactive in their sexual activity. But other, drugs cause no sexual activity. Interpersonal relationships are almost non-existent. And there's very little connection with other people because we're isolating from other people because we're ashamed of what's happening, essentially. Addiction is also so powerful that it's the only medical condition that will temporarily break the maternal and maternal bond with an addict and their child. This is very important because people will use this and say to individuals that are suffering with addiction, you have a child, don't you love them? And the short answer is yes, they do. But when your brain is working against you and is only focused on a chemical that you feel you need to use in order to survive, you will pick that over your child every time, not because you want to, because you have to. Okay? So addiction leads to this animalistic and antisocial behavior in an individual. So there's, criminal behavior, etc. This is why the person suffering with addiction cannot stop regardless of consequences. Our brains are now working against us as neurotransmitters, such as dopamine, are now motivating our brain to reinforce drug use. This cycle becomes unmanageable and deadly for the addict and will not be solved without medical and clinical intervention. Okay, next slide. There's this debate not only regarding addiction being a disease versus not a disease, there's also a debate about choice. And you will hear people say when people are discussing addiction, well, you have a choice. And the answer to that actually is no, that's not true. Because when you are in the grips and your brain and neurotransmitters are working against you and you have dopamine motivating you to continue to reinforce drug use in order to survive, you do not have the ability to make a rational choice. Because remember what we discussed, the prefrontal cortex, which has to do with good choices, is underactive. Okay, so this is really important to understand. So when drug abusers have found themselves in the grips, like we said, they have no choice. The brain has become completely rewired from the drugs. And the brain is reinforcing drug use due to the pleasure and reward that it's experiencing. Rational thought has stopped, and morals and values are completely lost. The addict will typically attempt to reduce their use on their own, but this is next to impossible to do without being placed in an inpatient type facility. You can't do it on your own. You may be able to do it for a little while. You may be able to do some maintenance for a little while, but it's not safe, A, and B, it's very, very hard to manage all of those symptoms by yourself. You really need a lot of support. You need to be in an environment that's conducive to recovery in order to maintain. And relapse is so prevalent because once the drug use is stopped, the addict will begin to experience these horrible withdrawal symptoms, depression, panic attacks. I mean, their moods are up and down. And they have this physical pain that's really, really, really difficult to get through. Also, gastrointestinal problems. I mean, it feels like you're dying, really. But you have to get through it in order to heal. So the things that were once pleasurable for an addict no longer provide any reward. They're not interested in any. They're depressed, and so this is why relapse happens, because they feel like that's the only thing that's going to make them feel good again. So most addicts will relapse at least once in their lifetime. Okay, next. Okay, but there is hope and healing foundation. With proper inpatient treatment, an individual seeking recovery can heal. Okay, so if treatment focuses on dual diagnosis, which, by the way, addiction is typically the result of a mental health issue that was already there. The substance abuser is often coping with a mental health issue or a trauma by using drugs and alcohol. All right. So what I will often tell my clients is it's not the drugs and alcohol that are the problem. It's something else, and you're coping with it with the drugs and alcohol. So there's a difference, and we have to get to the core issue. Okay. So treatment needs to focus on dual diagnosis, because even if there wasn't mental health going on underneath, and maybe addiction is the primary issue, there's definitely mental health side effects that are going to be happening that we need to get a hold of as well. So dual diagnosis treatment is essential. We need to focus on mind, body, and spirit. Very important. Doesn't have to be 12-step. It can be smart recovery. It can be, what's the other one? Starts with an R. I can't think of it right now. Refuge recovery. It was some Buddhism type of recovery, Christian recovery. So there, I think the other one was celebrate recovery. Some people use, Christian, based things, religion, whatever. I'm not a religious type person, but some people, that's what works for them. So use whatever works for you. But the most effective therapy approaches when it comes to addiction include cognitive behavioral therapy, and a subset of cognitive behavioral therapy is rational emotive behavioral therapy, which is my favorite, because these deal with assisting individuals with the cognitive distortions that they start to kind of develop that are caused by their addiction and their subsequent dual diagnosis. Okay, so it deals with belief systems. Most addicts struggle with traumas. They're telling themselves a story about the trauma that they've experienced. They're telling themselves a story about their life experiences. And it's our job as mental health specialists to interrupt that and show them what's real, as opposed to what they're saying to themselves. Medication is also very important to stabilize their mood as their recovery process begins. And, even early, you can go to the next one, even early on in the recovery process, you're going to have poor impulse control. Medication is very important to utilize in those early parts of recovery, in addition to 12-step, in addition to therapy. Mental health therapy is really number one. When it comes to the healing process, I just wanted to mention one more thing before we close. Is a lot of people wonder, well, how long does it take for your brain to kind of heal? What happens? And what really happens is it depends on the individual, how long it's going to take, but it's going to take a lot of time regardless. We're looking at years for some individuals, right? So this has to be something that people are really devoted to and committed to. But every day that goes by that you're clean and sober is a really good day. And new neural pathways are essentially beginning to build in your brain to start to heal some things. So one example that I always use, if I am right-handed and I have a job where I have to sign checks and I'm not allowed to use stamps, I have to only sign with my right hand, and I break my arm and I have no choice but to write with my left. When I start, it's going to look like shit, excuse my language, right? It's going to look crappy. But if I keep doing it every day, I become ambidextrous. And that's because there's a neuro pathway that's beginning to go to the other side that's essentially allowing me to adapt to this new situation, okay? The same thing happens with addiction. It takes time, it's messy in the beginning, but after a while, your brain starts to kind of adapt and come back. So there is healing that takes place. Okay, so that's all I have. Thank you so much for listening. I hope you got something out of it. And all of this information comes directly from NIDA. It is not mine. You can Google it, you can look it up. It's all there for you, free of charge. So I encourage that. Thank you.
That was great. Thank you.
Thank you, Jill. Thank you very much. Thank you very much. We're going to open the floor for any questions or comments for Ms. Jill. I can start off, Jill, by saying that was an excellent presentation.
Yeah, thank you.
Very informative on how medical-wise we can explain how drugs and alcohol affects us, our mind, our body, our everyday living, our soul. I want to really go back to what you were saying about actually like the drugs giving us a counterfeit, okay, of pleasure. Okay, and how the people, they talk about chasing that drug or chasing that first experience because that euphoric experience that that happened. So the brain is being tricked in the sense of using this counterfeit drugs. So when we're not getting those drugs anymore, okay, and you're kind of like unstabilized. I mean, what happens? How can that euphoric feeling come back, okay, when that first experience of that drug use is never going to come back, where they get that first experience back, or they just going to keep on chasing a kind of counterfeit feeling
when they're in active addiction?
Yes.
Yeah, so I will say, I think for every individual it's a little different, but from what I gather, we're typically chasing that first one. So there's this experimentation phase that we all kind of go through. And then for an addict, we have to remember they're genetically vulnerable, right? It's usually in the family system or it's in their environment somewhere. And so when they pick up a certain drug, there's this feeling of, oh, this is the answer. And that is where that euphoria is happening, and the amygdala and the basil ganglia are just they're firing out of control. And what it does is it creates a memory at that point too, right? So this is why we encourage clients, don't go back to where you came from. Change your people, places, and things, because as soon as you go back into that area and you smell those smells and you see those people and you are in that environment, your brain goes, oh, this is where that happened, right? Because it literally is falling in love with the chemical. So you become, yes, you're chasing that feeling. But I do think that people do experience that euphoria for a while in the beginning. They keep going back to that and they feel that same feeling. But after a certain period of time, you don't even get that feeling anymore. You don't get high anymore. And then it becomes just maintenance. And then you're in trouble.
Yeah.
It
was surprising when you were talking. I was taking a couple of notes, and you talked about the PET scan.
Mm-hmm.
Okay. And it took me back years ago when I first started to do substance abuse counseling, and this is the early 2000s. And I'm not sure that they fully got into the research yet, but I've heard about it. I was so excited about it because I'm doing drug and alcohol, and I say, you know what? There got to be a certain type of scan or something like that, like MRI and all this other stuff that
Yeah.
we can utilize as professionals to send these individuals there and see what's actually going on medical or mental wise. So when you
Right.
the PET, I say, hey, I remember that. I remember that scan. Okay, and I never followed up on it. But it's good that you presented it. I'll maybe do a little bit more research on it.
Yeah.
But you said an associate of yours actually was involved with that.
Or no more. I believe Dr.
Um,
had her hand up she raised her hand when you were talking about it.
oh, okay.
Uh,
Okay. So it's possible. Yeah, maybe. I didn't see her raise her hand. But
Yes.
no,
Go ahead.
yeah, the brain scan is incredible because what they did was they're essentially looking at glucose, right? Because that's what our burning. So
mhm.
you can see the glucose and where the activity is happening. So what they would do is like if I was to, as a recovering person myself, by the way, if I was to go into and get a brain scan and they were to show me pictures of cocaine, right? My brain's going to still fire even after 14 years being clean and sober, right? Because my brain's just going to react to that, right? But if you show me a picture of a puppy, it's like, oh, it's cute, but it's not as amazing as the picture of, right? So
Yeah.
there's this difference that happens. Whereas in a non-addict, they can see that, those parts of the brain aren't being as stimulated, right?
Mhm.
So, a lot of clients will say, well, why don't we just do brain scans? Why can't you guys just scan us? And
Yeah.
I say, well, insurance doesn't cover that kind
That
of
would be nice. Maybe one day.
yeah. I wish, but that's just not how it works out. But yeah, that's how they kind of found out how everything was operating. So it's fascinating stuff.
All right.
Awesome. Do we want to open up the floor to anyone else if they wanted to have a comment, question?
Dr.
Oh,
Do you have
anybody?
something to add?
Nope. Okay, she was just waving
No?
hi, I think,
Okay.
when she
All
did
right.
that. Yes, that's what she was doing.
All right. Anybody else have any questions or comments that they wanted to present to Ms. Jill?
Well, I have to say, I've been in quite a few presentations with drugs and alcohol included, say, not drugs and alcohol. And I would have to say that this is one of the ones that I can actually got information from, that you can understand it with hearing medical terms, with hearing all of this. And the examples that you gave were very understandable with all the terminology. So I would say I think I've heard some of this information before somewhere
Yeah.
along the lines, but I think I actually internalized some of this information. So I think it's
Wow.
very useful information as well. And I think it's very good for people to understand this stuff. And I think this is something to be added in, this type of information, along with when we're doing education on just mental health or sex education and all these different types of things that we say need to be added in for in our school systems and such. This is the type of information that should be added in as well, in my opinion, to help people understand a little bit more.
Yeah, yeah.
Absolutely.
I was especially intrigued when you started talking about alcohol and benzos, okay,
Yeah.
and those type of drugs, and how it really is a threat to your life, okay, especially when you're trying to get somebody off of it. Okay, I didn't know how serious that was, but when benzo use started to increase, okay, we went from I think what was it? V's volumes to Xanax and all this other stuff and whatnot.
Yeah.
And people were starting to abuse it real bad. Okay, the pill epidemic came and everybody was med seeking and so forth. And some of the psychiatrists that I was working with was actually refusing to administer or prescribe benzos anymore. I mean, it was a big thing in Pennsylvania at one time. We couldn't find a psychiatrist, child psychiatrist or adult psychiatrist to prescribe this stuff. And I was wondering why. And then I started seeing all the deaths. I started seeing all the repercussions of prolonged use. So we start talking about titrating down. And I didn't know how important that was to titrate somebody down off of these medications because, I mean, seizures, okay, was a major thing that people were experiencing and whatnot. But I mean, you can really have some real severe medical issues up until death. So I appreciate that information that you put out there because many people don't know the level of how these drugs interact, and especially most of the people who abuse them, they abuse alcohol at the same time.
Correct. And that's the scariest part. Mixing anything with alcohol and anything with benzodiazepine, because very often addicts they're not just doing opiates, they're doing it all. And what can happen to them? I mean, a lot of overdoses, although fentanyl is taking people out like crazy right now all by itself. But there was a time when a lot of overdoses that were happening that were being blamed for opiates, benzodiazepines were involved as well. It essentially stops your respiratory system, right? So when you have that combination. So benzo is just bad in every sense of the word, and alcohol is also just, terrifying. So, what it does to your body and what it does to your mind, especially. You can't get a lot of that back sometimes. So
yeah, it's serious. You know what I used to tell when I was doing relapse prevention, and I used to utilize this. You just threw this out the door. I'm going to let you know this. I used to always tell the clients, you have about 5 actionable things that you're going to do before you use. Okay, and it's meaning 5 chances to stop yourself. Okay, because you're going to think about it. You're going to make that call. You're going to get the works. You're going to travel to get it. And then you're going to put everything together to use it. Okay, so it's about 5 steps. So I always tell people, stop, think about it, think about the repercussions and react, competently. But now, since you're saying that, hey, listen, their brain is hijacked, okay, and I say, why can't you do this? You just explain it. They're not, coherent enough or cognizant enough, okay, to stop themselves. Okay, it's almost like it's now their lifestyle, okay, and their brain has been hijacked. So I appreciate that information.
Exactly. You're welcome.
All right. Anybody else who wants to add? If not, we are going to actually have 5 more minutes.
I actually did raise my hand this time.
All right.
All right.
I was waiting. I wasn't sure.
Dr. Blue, nice to meet you.
Dr. Blue.
Nice to meet you all. Thank you. Jill, excellent job as always. Love listening to Jill anytime.
Love you, girl.
Love you. So I think that this conversation, we can't see it and hear it too much because it's so important to educate one another and the clients in this way. Because I feel like they can really relate to it when I talk about the hijacked brain with them. They can really relate to it and understand it. And they can understand their disease in a way that makes sense to them finally. Whereas before, even the families, they're like, well, why can't the person just stop? And when you explain it to them in this way, and you guys really taught me that actually over at Above All Recovery is where I really learned about this more than I'd ever seen it before. When clients and families learn it in this way, they realize there's this real chemical piece to it. There's a real out of control piece to it, and something that relates to our deepest biology that makes sense. So I use this information a lot. I love hearing it. So I just wanted to say that it's just an ongoing conversation. And we're just learning more and more about the brain and these scans and how things interact. So it's good that we've evolved to the point of understanding how much this impacts people in a mind, body, spirit way, and especially with the brain. So just thanks for sharing it.
Yeah.
Thank you.
Thank you.
It's great to see you.
Thank you for your input, Dr. Bloom. And you're correct is that we need to continue this, continue the fight, continue the education, and, you know, continue to do presentations like this. You know, our presentations are being recorded. Okay, so we're going to, you know, put this online, put this on our website, and hopefully with this information can help somebody or give them some insight to reach out to us. And once again, I want to say, Jill, we appreciate you. Jill is, just a reminder, folks, Jill is actually conducting outpatient therapy in the state of Florida. She takes a lot of cases, a lot of backgrounds from mental health and substance abuse, as you see. And Jill, I believe that you're open for new clients right now, right?
I sure am.
All right. Well, folks, I really want to end this meeting by saying that drug use, alcohol abuse, or drug abuse, alcohol abuse is very serious. We're getting to a point in the world that, you know, pills, cocaine, alcohol, anything is prevalent everywhere, especially for our kids. And when Jill was talking about how children don't even have developed brains because of drug use, because they start using at a certain age, and by the time they're 20-something years old, they're not fully developed. Okay, these are some of the issues that we're experiencing in mental health and how it's becoming a crisis. Okay, so we're here for the fight, and we appreciate people like Dr. Bloom, Ms. Jill, and everybody else out there in the fight to end drug abuse. And we appreciate y'all from the Hope and Healing Foundation for Suicide Prevention and Mental Health Awareness. We thank you.
You can always join us, and it'll always be the last Wednesday of the month. Different topics, and you'll see them on our Facebook. So welcome to join anytime. So thank you, and you all have a great night, and thank you for taking the time out.
Thank you, folks. See y'all next month.